Okay, now let's talk a little bit about the types of pumps and channels you're going to find on a neuron. First, let's talk a little bit about voltage-gated sodium channels, and I want you to know that they have two gates. They have an inactivation gate and an activation gate, and this allows them to exist in three separate states. So the first state they exist in is the resting or the closed state. The inactivation gate is open, but the activation gate is closed, and this is going to prevent sodium from crossing through. Now what happens is a change in membrane potential here is going to trigger the activation gate to open, and now the channel exists in the activation state with both the activation and the inactivation gate open. This is going to allow sodium to cross through the channel. After about 1 millisecond, the inactivation gate is going to trigger and it's going to close. And now we've got the channel back to the inactivation or the closed position. All right, I want you to know that across the entire plasma membrane of the neuron, there are going to be leak channels, sodium leak channels and potassium leak channels, and there are going to be sodium-potassium pumps. And the job of these channels and the pump is to maintain the resting membrane potential. So remember that the sodium-potassium pump is going to pump 3 sodium out of the cell and 2 potassium into the cell. And then you've got a sodium leak channel that's going to allow sodium to leak across it, and potassium leak channel that's going to allow potassium to leak out of the cell, okay? And all of these just establish the resting membrane potential. Okay, so which kind of channels are on which part of the neuron? Well, the dendrites in the cell body are going to have chemically gated channels, and the axon hillock and the axon are going to have voltage gated channels. And this should make sense because the cell body and the dendrites are receiving chemical signals from another neuron. So their channels need to be opened by chemicals, by those neurotransmitters. So all of these gated, these chemically gated channels here, they are going to be triggered open generally by a neurotransmitter of some kind. All right. Now all of those inputs get put into the dendrites in the cell body, and it all travels to the initial segment here, or the axon hillock, and the summation of those signals is going to determine whether an action potential is generated here, okay? And when an action potential is generated, there's going to be a change in the resting membrane potential. So these are going to be voltage-gated channels. And that membrane potential is going to propagate down the axon through the sequential opening and closing of these voltage-gated ion channels. Okay, and when the signal goes all the way down the axon and reaches the synaptic knobs, remember that there's going to be voltage-gated calcium channels that open. So these voltage-gated calcium channels are going to allow calcium into the synaptic knob, and they're going to trigger the release of neurotransmitter. You're also going to have calcium pumps in that area, and what calcium pumps do is they pump the calcium back out of the cell to reestablish the normal resting membrane potential there. Okay, so neuron activity, or the ability of a neuron to transmit an impulse, is going to depend upon electrical current. Let's talk about voltage. It's measured in millivolts, and this is the measure of the amount of difference in electrical charge on both sides of the axon membrane. So let's say that the electrical charge here is positive 30 and the electrical charge here is negative 30. Well, the voltage would be 60 millivolts, right? Because it would be the difference in the electrical charge on both sides of the axon membrane. Resistance, this is going to be the opposition to movement of the charged particles. So the plasma membrane is the resistance here. Particles can't cross over the plasma membrane without a lot of resistance. And that's why we have gated ion channels. The movement of charged particles across the plasma membrane through these open channels, that's going to be your current. And that brings us to Ohm's law, which is V equals IR, where V is the voltage, I is the current, and R is the resistance. And now if you wanted to rearrange this formula to solve for current, you would see that current is equal to voltage over resistance, which means that current increases with the larger voltage and increases with the smaller resistance. So the less resistance there is, the more current, and the more voltage there is, the more current, okay? As applied to neurons, so charged particles are ions, and the current is going to be generated when ions diffuse through those channels. Voltage exists across the plasma membrane due to unequal distribution of ions, we know that. And the membrane offers resistance to ion flow, and this resistance changes due to the actions of gated channels. So your resistance is obviously going to decrease when those channels open. Because the characteristics of neurons at rest, the ions are going to be unevenly distributed across the plasma membrane, like we said. And remember, this is due to the actions of those pumps that establish and maintain the resting membrane potential. I need you to know that there's a higher concentration of potassium inside the cell, and there are higher concentrations of sodium, chloride, and calcium outside of the cell in the interstitial fluid. Gated channels are closed in the functional segments of the cell. That makes sense, right? Because you only want the gated channels to open when there's an impulse coming. So at rest, they're going to be closed. And at rest, there's an electrical charge difference across the membrane. So the cytosol is relatively negative compared to the interstitial fluid. Your resting membrane potential of neurons is going to be about negative 70 millivolts. This difference can be measured with microelectrodes and a voltmeter. Okay, so here you have the cell body and the dendrites coming off of it, and you can see there's a lot of sodium outside of the cell, a lot of chloride outside of the cell. And we have chemically gated ion channels here, chemically gated to receive chemical input from another neuron. Now, when that neurotransmitter binds here and opens these channels, it's going to allow, for example, chloride into the cell, and this will change the membrane potential. And if there's enough change in the membrane potential, it'll start triggering these voltage-gated channels to open. And they're going to open sequentially and close sequentially and propagate that impulse down the axon like this until it gets to the synaptic knob. Then you're going to get influx of calcium through those calcium channels, and that's going to trigger the release of neurotransmitter. Okay, here's that sodium-potassium pump again. You have to know this. It's going to transport 3 sodium out of the cell and 2 potassium into the cell, and this maintains the concentration gradients for these ions throughout the neuron. Okay, so we have the receptive segment here, the initial segment here, the conductive segment here, and the transmissive segment down here. Let's talk about each one of these segments. The receptive segment, this is where binding of neurotransmitter released from presynaptic neurons is going to occur, and it's going to produce it's going to result in the production of graded potentials. Okay, so graded potentials, that just means changes in membrane potential that vary and that can be added up. And now if they add up and it's close enough to the initial segment, if all of those graded potentials add up and trigger a response at the initial segment, the voltage-gated channels will open and close sequentially and propagate that signal down the axon. And then when the axon, when the impulse gets to the synaptic knobs, the action potential is going to cause the release of neurotransmitter. And this neurotransmitter is either going to bind to another neuron and cause the whole thing to start all over again, or it's going to bind to a gland or a muscle and cause an effect. Okay, so let's talk about the different kinds of potentials you see in the receptive segment. So excitatory postsynaptic potentials, these are depolarizations, okay? They make the inside of the cell more positive, and they're caused by cation entry. So what happens, you have the presynaptic neuron here. It releases neurotransmitter. That neurotransmitter is going to bind to chemically gated cation channels on the receptive segment of the postsynaptic neuron. And that's going to allow for the influx of cations, and that's going to make the inside of the neuron more positive. You can see it on the graph here. You have the stimulus, and you see a little bump where the inside of the neuron has become a little bit more positive than the outside of the neuron. Now, if nothing else happens, this is the only thing that you see. But if you get a lot of these excitatory postsynaptic potentials, they're going to add up, and they could potentially cross the threshold, and that would trigger an action potential in the initial segment. Inhibitory postsynaptic potentials are going to be hyperpolarizations, so they're the opposite of the excitatory potentials. And they're going to be caused by either cations exiting the cell or anions entering the cell. And this is going to make the inside of the cell more negative. You can see here, neurotransmitters have been released. They're binding to the chemically gated channels. And there's going to be an efflux or an exiting of cations or an influx of anions. And that's going to make the inside of the cell more negative. And you can see that here with the decrease in membrane potential from the stimulus. Now, when you use inhibitory potentials, what you're doing is you're making the resting membrane potential more negative, and it's going to be harder to reach this threshold in order to trigger an action potential. So that's what makes this inhibitory, okay? It just makes it harder for the cell to reach threshold. Okay, so here we have an image showing a postsynaptic neuron. And look at all of these inputs that it's getting from the presynaptic neuron. So there's a lot of synaptic knobs that communicate with the cell body. And you can see the green ones. These are going to be your excitatory potentials, these excitatory inputs. And the red ones are your inhibitory inputs. And what happens is these are firing at the same time. You're going to be getting inhibitory signals and excitatory signals at the same time. And it all gets added up down here kind of in the initial segment. And if it's enough to trigger an action potential, it will. And here's a good image. You can see all of the synaptic knobs communicating with the postsynaptic neuron. And remember, these are called graded potentials because they can add up. Okay, the conductive segment, we said all of this. The axon conducts action potentials. Depolarization is going to make the cell more positive. Repolarization makes the cell more negative. The action potential is propagated down the axon to a synaptic knob. Voltage-gated channels open sequentially down the axon. And the propagation of the action potential is called an impulse or a nerve signal. Okay, so let's go through the action potential step by step. So here are the steps in depolarization. At resting membrane potential, which is about -70 millivolts, voltage-gated channels are closed. As sodium enters from an adjacent region inside the cell, so it's going to enter from here, these voltage-gated sodium channels are going to open. So we're getting something in the initial segment. We're getting ions in the initial segment, sodium, that's changing the resting membrane potential. Here you can see it's become less negative because of the influx of sodium. Sodium enters the axon, causing the membrane to become more positive. We said that. Sodium channels automatically close after a certain period of time, becoming inactive. And then this is going to repeat these steps in adjacent regions as the impulse moves down the axon toward the synaptic knob. And you got to go through and really pay attention to which gates are open on the voltage-gated sodium channel at which times, and pay attention to this graph too, okay? Next, the potassium channels are going to open. Potassium is going to diffuse out, so you're losing positive ions. That's going to cause the inside of the cell to become more negative. And you can see that here on the graph. We went really, really, really positive with all that sodium coming in. Now the potassium channels are going to open. Here's potassium leaving the cell, and it's making the cell more negative. Potassium channels stay open for a longer time than the voltage-gated sodium channels do. So the potassium exit makes the cell more negative than the resting membrane potential. So basically, potassium overshoots the target, and you can see here it's hyperpolarized compared to the resting membrane potential. It goes a little bit beyond -70. The potassium channels are eventually going to close after a set duration, and the resting membrane potential is reestablished. So here we are back at the resting membrane potential. And then these steps are going to repeat in adjacent regions as the impulse moves toward the synaptic knob. And this is what resets the membrane potential. Okay, so on this graph, here you have the neuron at rest, resting membrane potential -70. And here you see some excitatory impulses coming in at the cell body. And you know they're excitatory because they're making the cell more positive. So they're getting closer to threshold. Now, if you get enough of these excitatory impulses, if you get enough of them in a short enough time, they're going to add up, and they're going to push past threshold here. And now once you hit threshold, an action potential is going to be generated, whether you like it or not. This is an all or nothing event. The action potential either goes when you hit threshold, or you don't hit threshold and it doesn't go. There's no in between. So once you hit threshold, the action potential is generated. Sodium channels are going to open, and here's that sodium coming into the cell, making it much, 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 much more positive. Then you're going to have the potassium channels open and the sodium channels close, and you're going to have potassium exiting out of the cell. And that's this part of the graph here. And now the cell is becoming more negative, more negative, more negative. And then remember that the potassium channels are still open here, and now they're closing, and now we're back to resting membrane potential.
A nerve impulse is an electrical current that travels along dendrites or axons due to ions moving through voltage-gated channels in the neuron's plasma membrane. Voltage-gated channels open and close in response to an electrical voltage, so they are affected by changes in electrical charge around them. When a neuron is at rest, a charge difference is maintained between the inside and outside of the cell. This charge difference is produced and maintained largely by active transport using sodium-potassium pumps. The pumps send sodium ions out of the cell and bring potassium ions in. While other channels allow some flow of potassium ions back out of the cell, the sodium ions cannot easily get back in to replace the lost positive charges. The overall result is that the exterior of the cell has a net positive charge and the interior has a net negative charge. The difference in charge between the interior and exterior of the cell is called the resting membrane potential. A nerve impulse begins when a stimulus disturbs the plasma membrane on a dendrite, causing sodium channels to open. Sodium ions flow into the cell, lessening the charge difference at that location. If the change is enough, it will cause nearby voltage-gated sodium channels to open. This allows so many sodium ions to flood into the cell at that location that the membrane there is depolarized, with the local region inside the cell having a net positive charge and the outside of the cell having a net negative charge. This affects neighboring voltage-gated sodium channels, which then open, moving the depolarization along the membrane. This moving depolarization is called an action potential. Changes occur behind the action potential to restore the resting membrane potential. The voltage-gated sodium channels close and voltage-gated potassium channels open. This allows a rapid flow of potassium ions out of the cell, repolarizing the membrane so that the inside is again negative and the outside positive. This is followed by use of sodium-potassium pumps to fully restore the resting membrane potential and to reestablish proper concentrations of sodium and potassium ions inside and outside of the cell.
Okay, the refractory period. This is going to be a period of time after the start of the action potential when it is impossible or difficult to fire another action potential. So the absolute refractory period lasts about 1 millisecond. This is when it's impossible to fire another action potential. Sodium channels are open and then they inactivate. And it's during this inactivation that the absolute refractory period occurs. What this does is this ensures that the signal, the impulse, is going towards the synaptic knob. It doesn't reverse direction. Then you have the relative refractory period. This is right after the absolute refractory period, and this is when another action potential is possible, but the minimum stimulus to generate that action potential is now greater. And this is because those potassium channels are still open, so the cell is slightly hyperpolarized and further from threshold. Okay, continuous versus saltatory conduction. So continuous conduction, this is going to occur on unmyelinated axons. And this is what we've been seeing. This is where the charge opens the voltage-gated channels, which allows the charge to enter and then spreads to the adjacent region and opens more channels sequentially and so on and so forth. This is what we've been talking about, is continuous conduction all the way down an axon. Saltatory conduction, on the other hand, this is going to occur on myelinated axons, and it's much, much faster than continuous conduction. So what happens is an action potential is only going to occur at the neurofibril nodes. And this is where the axon's voltage-gated channels are concentrated. So after sodium enters at a node, it's going to start a rapid positive current down the inside of the axon's myelinated region. And the full action potential occurs at the node, and the process repeats. The impulse seems to jump from node to node, and I'll show you what I mean right here. You have the nodes of Ranvier, or the neurofibril nodes here. This is where all of the voltage-gated channels are going to be located at these nodes. So you're going to have sodium influx here, and it's going to rapidly move down the axon, and bam, it's going to hit the next region of voltage-gated channels. Sodium influx, bam, down rapidly down the axon. Sodium-gated channels open, and so on and so forth, okay? Okay, so what happens when you get to the transmissive segment or the synaptic knob? Well, the arrival of the action potential at the synaptic knob is going to open those voltage-gated calcium channels. And remember, calcium is going to diffuse into the cell. Calcium influx triggers exocytosis of neurotransmitter. The neurotransmitter is released into the synaptic cleft, where it binds to a receptor on the effector cell. I want you to know that the effects of the neurotransmitter on the receptors of the postsynaptic neuron is going to determine whether the presynaptic neuron is sending an inhibitory signal or an excitatory signal. So it's the effects of the neurotransmitter on the receptors that determines whether it's inhibitory or excitatory. So here we've got the action potential that reaches the synaptic knob. Now we're going to have calcium influx into the cell. Calcium is going to trigger the release or the exocytosis of neurotransmitter. Neurotransmitter spills into the synaptic cleft, crosses the synaptic cleft, and binds to postsynaptic receptors on the effector cell, either another neuron or a muscle or a gland, okay? So what are neurotransmitters anyway? Well, they're small organic compounds synthesized by neurons. They're stored in vesicles in synaptic knobs. They're going to be released by exocytosis when the action potential triggers calcium entry into the knob. They trigger a physiologic response in the target or the effector cell. And there's about 100 different neurotransmitters that we've found and classified. The four main chemical classes of neurotransmitters are going to be acetylcholine, biogenic amines, amino acids, and neuropeptides. So acetylcholine is its own class of neurotransmitter, and this is because the structure differs substantially from other transmitters. The biogenic amines, also called monoamines, this is an amino acid that's been slightly modified. Catecholamines, like dopamine, are going to be made from tyrosine. The indolamines, like serotonin, are going to be made from histidine or tryptophan. What you need to know is that they are modified amino acids, okay? Then you have regular amino acids that can be neurotransmitters. This includes glutamate, glycine, and GABA. You can also have neuropeptides. These are chains of amino acids, short chains, that include endorphins, enkephalins, and substance P. Okay, here is the chart of several different neurotransmitters. So I would like for you guys to go through and familiarize yourself with a few of them. You should definitely know acetylcholine. You should know norepinephrine. Really, you should know all of the catecholamines, dopamine, norepinephrine, and epinephrine. But focus on norepinephrine. Ideally, you should know histamine as well as serotonin. Glutamate, know that this is an excitatory neurotransmitter. And GABA, know that this is an inhibitory neurotransmitter. The neuropeptides, just kind of know that they're small molecules made of chains of amino acids, and they're going to include your naturally occurring opioids. So the enkephalins, the endorphins, endomorphins, dynorphins, and nociceptin, okay? So acetylcholine is the best characterized neurotransmitter. It's used in the peripheral nervous system to stimulate skeletal muscle, and it's used in the central nervous system to increase arousal. It's going to be synthesized from acetate and choline and stored in synaptic vesicles. We already know that. An action potential is going to trigger its release into the cleft. Some acetylcholine is going to attach to postsynaptic receptors after it is released into the cleft. And then acetylcholine is going to be cleared from the synaptic cleft by being broken down to acetate and choline by acetylcholinesterase, okay? That's a pretty important enzyme to know. Acetate and choline are then going to be taken back up by the neuron and recycled and turned into more neurotransmitter. So here you have the nerve signal coming in. There's going to be an influx of calcium. Calcium is going to cause exocytosis of acetylcholine. Acetylcholine is now in the synaptic cleft, where some of it will bind to postsynaptic receptors on the target cell. Note that acetylcholine's effect on the target cell is going to depend on the receptor. So if you have a nicotinic receptor, like this one, that's going to directly cause an excitatory potential. If you have a muscarinic receptor, like this one, this can cause either excitatory or inhibitory, depending on what the G protein and second messenger do. Okay, so once the neurotransmitter is at the synaptic cleft, how does it get removed from there? Well, there's three different ways. We already talked about acetylcholinesterase. That's an enzyme that degrades acetylcholine. But you could also have presynaptic transporters that might bring back the neurotransmitter or reuptake the neurotransmitter. And then some transmitters simply going to diffuse away from the synapse and be reabsorbed by glial cells. Some drugs are going to have their effect by influencing transmitter removal. So, for example, the selective serotonin reuptake inhibitors, these treat depression by basically inhibiting the neuron from reuptaking serotonin. So this leaves more serotonin in the synaptic cleft, so there's more serotonin to bind with receptors, and the longer those receptors will be activated. Dopamine, I want you to know this is the primary neurotransmitter released in pleasure and reward centers of the brain, and it's going to promote feelings of happiness. It inhibits motor movements, and a deficiency in dopamine, you can be unhappy, tired, unmotivated, and in extreme situations, a deficiency will lead to Parkinson's disease. Epinephrine, this is an important neurotransmitter in the sympathetic nervous system. And remember, this is the fight or flight branch of the nervous system. It's going to relax the airway muscles so you can take nice big deep breaths. And it's going to constrict blood vessels away from the skin and direct blood flow towards the muscles, the heart, and the lungs. It's also going to reduce your ability to feel pain and increase your strength and physical performance. All of these things you need in a fight or flight response. Norepinephrine increases alertness, arousal, and attention. It works with epinephrine during the fight or flight response, and a deficiency in norepinephrine can cause depression, ADHD, fatigue, and lack of focus. Serotonin is going to help regulate anxiety and happiness, and it plays a role in sleep cycles, digestion, bone health, and wound healing. A deficiency is going to lead to depression and anxiety. GABA, this is your most common inhibitory neurotransmitter in the brain. I want you to know that. It decreases the stimulation of neurons by reducing the neuron's ability to receive, create, or send chemical messages to other neurons. GABA has a calming effect. It's involved in responding to stress and fear. A deficiency of GABA is implicated in autism spectrum disorder, Parkinson's disease, epilepsy, and schizophrenia. Beta endorphin, this is an endogenous opioid involved in stress relief and pain management, and it's basically secreted to help you survive during trauma and stress. You'll see increased levels during and after exercise, massage, and sex. Nitric oxide is a very short-lived gas. It's nonpolar, and it is a neurotransmitter. It's going to be released by neurons in the brain where it's believed to strengthen memory. Effects in the peripheral nervous system of nitric oxide is going to include blood vessel dilation. And then you have the endocannabinoids. These are small nonpolar molecules, they're lipids, that influence memory, appetite, mood, reduce pain sensation. They're also involved in fertility and pregnancy, and they bind to the CBD1 and CBD2 receptors in the body. Okay, I just want to talk just a little bit about the different ways that neurons can be arranged, and then we'll be done with this chapter. So groups of neurons are arranged in patterns. We have the converging circuit, and we have the diverging circuit. So the converging circuit, this is where input converges at a single postsynaptic neuron. So you have multiple neurons here, and they're all sending their input to one single neuron. For example, multiple sensory inputs synapse on neurons in the salivary nucleus. So let's say that this is information from your eyes, this is information from your tongue, this is information from your nose. It's all coming in, and all of this information is going to result in one output, and that is salivation. Contrast this with a diverging circuit. This is where information is going to spread from one presynaptic neuron to several postsynaptic neurons. And for example, this would be neurons in the brain that control walking. They're going to send commands to several different muscles for proper balance, posture, and motion.